Hey, Mr. Smith, how you doing today? Good. Excellent. They tell me that you've been having a little bit of swelling in those legs. Is that right? Is it painful also? Yeah. Very well. So what I'm going to do is they want me to evaluate, and we're going to look all the way from your groin all the way down to your ankle on the inside of your leg there, as we have our major vessels in there. So just a quick 101 on what is happening inside of there and why we're here. So out of our heart, the aorta, the blood, it brings the blood down to our feet through the arteries, and it returns back up to our heart through the veins. When those veins are coming back up, there's a deep system. I call that like the main highway. And so we're going to be evaluating that deep system to make sure there's no blood clots, also known as a DVT or a deep vein thrombosis. And so we will compress each vessel along the way, and then we will also put color flow and Doppler in those vessels to make sure that all the blood is getting through and that there is no blood clots. Blood clots, it does affect the United States pretty heavily. About 100,000 people a year die from a blood clot. So we are here to try to prevent that at Lifesavers. I can look through all your vessels and make sure that everything's clean. But we also can look at the actually superficial system, and what that does, it's right next to that deep system, and it comes back up, and it has about 12 valves in there. And in between each heart rate, those valves should close and hold that blood flow, but due to life, genetics, whatever it may be, those valves start to fail, and they go down like this, and they go back, and they don't hold the blood. Therefore, we can get swelling, we can get redness, varicose veins. So that's what we're going to do, looking for a blood clot and make sure you don't have a DVT, and also make sure that all of your valves are working properly within your legs. And then on the next aspect of it, we're also going to look at the arteries in your legs. And so what we're looking for here is the arteries, as I said, bring that blood flow all the way down to your feet. And so in there, what can happen is you can get blockage, and that's from an accumulation of plaque, and it's usually related to diabetes, smoking, or improper diet. And we can get plaque filled up in our arteries, and if that happens, then we can't get blood down to our feet. Then we will start getting cold feet, we can start getting painful toes, painful legs, and then eventually we get it to where there's not enough blood supply there, and we have amputations that will happen at a pretty high rate when you're not getting the proper blood flow, or wounds that will not heal. So we're going to look at the blood flow in both of your legs and make sure that this blood flow that's coming down is going properly, and that the veins are returning it, that there's no blood clot in there. And that's what we're going to be evaluating today. Sound good? All right.